everyone. Welcome to an all new episode of Finding Joy in Your Vestibular Migraine Journey. I'm so excited today because we have with us Dr. Carrie Sypherd. She is with us from Behavioral Vision in Crystal Lake, Illinois. Dr. Sypherd is a graduate from Purdue University, an associate member of the College of Vision Development, past president of the Fox Valley Optometric Society, and part of the Illinois Optometric Association. Dr. Sypherd primarily treats patients with traumatic brain injuries, developmental delays, educational difficulties, and autism spectrum disorders. Dr. Sypherd also participates in an annual eye care mission trip to provide care to patients who do not have access to eye doctors. And specifically, I am so excited because I have been a patient of Dr. Sypherd's for over 10 years. She has been my help and hope throughout my journey, and she has been extremely helpful when no other providers knew what to do with me. She's seen me in my good times and in my terrible times. She has always made herself available to me and just has been one of the most helpful people that I have ever met. She has always validated all that I was feeling mentally and physically without judgment. I am forever grateful, Dr. Sypherd, for all you do. Hi, everyone. Hi, Dr. Sypherd. Thank you so much for being with us today. So excited to have you here.
Thank you.
Welcome. Thank you for taking time out to meet with us. We really appreciate it.
Gladly.
Can you tell us how you started in this profession? And what was your interest? What kind of drove you to seeking this specialty?
Absolutely. When I was in college, I paid my way through college by working in a nursing home, which I loved. And I saw lots of different illnesses, lots of different disabilities. And while I was there, I thought about what would be the most disabling disease or disability that I could have. And for me, the answer was vision. And that is true of a lot of people. If people can't use their vision, they feel very limited. Thankfully, since the time that I was in college to now, technology has really changed. So there are audiobooks available. There are self-driving cars that are eventually going to be more mainstream. There are a lot of options for people who have limited visual function, but I still feel that that would be the most limiting sense if I were to lose it. So I thought about my patients in the nursing home, and a lot of them were there because they were not able to be independent. And I thought about what their lives could be like if they had regular visual function and could go back to doing the things that they would like to do in life. So being able to move through the house safely without having any falls, being able to do daily chores, washing dishes, folding laundry, all of the things that we need to be able to do, being able to see to make meals for themselves, being able to play games with their family, or being able to take care of their loved ones safely. All of those are factors for independence, but the patients that I was seeing in the nursing home did no longer have that independence. So when I entered optometry school, I was certainly interested in sight, which is one part of vision. And then I became much more interested in behavioral vision, which is an understanding of where you are in space and how the brain processes the information that is coming in through the eyes. So it's much more about the brain than it is just about the eyes themselves.
Yes. Well, that's very interesting. I didn't know that that was your background because I worked with Alzheimer's residents for a long time after college. So I love that population. Another question we had was, what type of treatment does your office provide? I mean, I know what I've gone there for, but, what does your practice primarily serve? What kind of population and what kind of treatments do you offer?
Well, we see patients of all ages. My youngest patient so far was 2 weeks old. My oldest patient was 108. So I see every age range in between. Most of my patients have some sort of neurological difficulty, but not necessarily. So we do comprehensive eye exams that test more than just the sight part. Sight is just one aspect of vision that tells us what is it. But vision answers 4 basic questions. Those are, what is it? That's the 20/20 part. The next part is, where is it in space? That's depth perception. Next is, where am I in relationship to it? That's the vestibular function that we've talked about so much, and proprioception, knowing where your body parts are. And then the last part is, what do I do with it? How do I make sense of all of this visual information that is coming in and then use it so that I can be safe and be able to do all of my activities of daily living? So all of that takes a lot of energy. The visual processing is about 80% of the function of the brain. So if it's not working well, it becomes exhausting. It causes fatigue and affects quality of life. So based on the exam results that we see after the exam, we offer vision therapy. We offer dry eye treatment. Dry eyes are definitely a factor that are occurring more as we tend to stare when we're looking at computer screens and TV screens and reading books. We don't blink often enough. We also offer myopia management. Myopia is nearsightedness, which is becoming an epidemic. By 2050, entirely half of the world's population is going to be myopic or nearsighted. And our goal is to prevent that, as well as preventing all of the diseases that go along with myopia. We also do routine kindergarten exams to make sure that kids have the visual skills necessary to be able to learn in a kindergarten classroom. Again, it's more than just, can they see the letters on the chart? We also do the Department of Motor Vehicles, the DMV exams, to make sure that the people who are out on the road driving around us are safe to be driving around us. We want to make sure that people aren't getting into accidents and hurting themselves or others. We do glaucoma treatment as well. We also have reading specialists that do reading intervention for children who have difficulty learning to read, or adults who have difficulty with reading fluency and reading comprehension. We do primitive reflex integration for children who have had traumatic or anomalous births. Sometimes children who are delivered by C-section instead of vaginally have retained primitive reflexes that impede their development in life. We also fit specialty contact lenses. There's a disease condition called keratoconus, which affects the front of the eye, that requires specialty contact lenses. And we do fitting of contact lenses for color deficiency. There are a lot of people who need to be able to differentiate colors for their jobs, and if they have color deficiency, aren't able to do that well. We also do vision therapy for sports improvement, so sports vision therapy, and we have low vision devices for people who have glaucoma or macular degeneration or retinitis pigmentosa, all of the diseases of the retina that make it so that they cannot see well and discriminate letters. We coordinate therapy with occupational therapists, physical therapists, developmental therapists, speech therapists, psychologists, internists, psychiatrists, schools, and we also work with orientation and mobility specialists. Those are for people who are functionally blind but still want to maintain their independence. So the orientation and mobility specialist will go into their home and help set up their home environment so that they can be safe, and give them tools and tricks. For example, if you're cutting a white onion, if you cut it on a black cutting board instead of a white cutting board, it's much easier to see. They also will put puffy paint on the oven or the stove to be able to determine temperatures. And again, try to keep people as independent as they possibly can be.
Wow. That's
Yeah.
a lot that you do. That's amazing.
That is amazing. Yes. And what is the typical patient that would be a good candidate to see you? I mean, it sounds like very broad spectrum.
Yes.
So I imagine you see most everybody.
I do. And again, I love working with all ages. I do see nonverbal people as well, whether they're people who are on the autism spectrum and can't communicate verbally, or people who have aphasia after a stroke and can't communicate verbally. So really, I will see absolutely any patient who has difficulty functioning with their eyes open. If they don't have any concerns, people usually don't need to come see me, just have their annual exams to make sure their eyes are healthy. But if they're having any difficulty with getting through their daily routine or moving their bodies through space, those are the patients that I want to see. People who have difficulty driving, who have difficulty reading, they have eye strain, headaches, dry eyes, double vision, difficulty with depth perception, eye-hand coordination, general fatigue, or if they've had a history of a stroke, a traumatic brain injury, developmental delay, strabismus, which is an eye that turns in or out or up or down that doesn't align with the other eye, traumatic birth or premature birth, certainly, or again, any type of brain injury, whether that's intentional, meaning a surgery, or accidental, a fall or a stroke or a traumatic brain injury.
Okay. And what typically would a first-time patient expect when they come to their first appointment? I know it depends on what maybe they're coming to see you for, but generally, how does the appointment go?
We schedule an hour and a half for the initial exam so that I can make sure that I answer all of their questions. Many people who come in to see me already have an extensive history. If they're able to prepare their records ahead of time and send them to me ahead of time, I will review all of those so that I'm aware of what they've already done, the treatments that they've already had before they come in. If not, that's okay. They can come in without any of that information. And a lot of times parents are surprised because I make a deal with their children. If it's a child that's coming in for the exam, the deal I make with the child is that everything that we do here is fun. If you're not having fun, you just tell me you're not having fun and we'll do something else. That really relaxes the child, and we usually have a great time and they're laughing by the time they leave. I also make a deal with the parent, which is that while we're together in the exam room, I only want to discuss the positives. I want to make sure that the parent doesn't talk negatively about the child in front of the child. So we try to keep the experiences really positive. Usually the parents are surprised that within the first 5 minutes, I can tell them what's going on with their child and tell them things about their child that they didn't tell me, but are absolutely true about how they're performing in school or with sports or even socially based on how their vision system is presenting. So there's a lot that we can determine just by watching how a person moves and how they look at the world around them.
Wow.
Yes, I know you've
Again,
done that with me. So, yes.
well, can you talk about some of the eye exercises that you have your patients do, especially maybe some of the vestibular patients? Because I'm sure most people, we've done the eye exercises. So what type of eye exercises are you having your patients do?
Absolutely. I will say that for all of our patients, vestibular, absolutely, but everybody who comes in, there are 4 basic aspects to healing. Number 1 is quality sleep. If your sleep is really restorative and you're waking well rested, that changes everything about your day as well as your overall health. So number 1 is sleep. Number 2 is proper nutrition, and that can vary person to person on what their body needs. So if we can improve nutrition, that is also a complete game changer for how you feel and how you function. Number 3 is exercise. And when you're having those bad vestibular days, it's hard to get up and move your body anywhere off the couch or off the floor, much less to go out for a run. So we want to make sure that we can get that in on the good days. And then number 4 is happiness. That's doing whatever it is you love, following your passions and making sure that you're having fun and being able to laugh during the day. And as you know, some bad vestibular days, it's hard to laugh and
Yes.
it hurts. It's uncomfortable and you don't have a lot to laugh about. But if we can address those 4 areas, that makes everything easier. So regarding the vision exercises, I do have a specific set of vision exercises that we do with patients. Not all patients need to do all of the exercises, but they do a lot. They do look a lot like what you've been recommended from your vestibular therapist.
Mhm.
And I have all of those as videos on my website, so you can go straight to the website and see those. But even more importantly, we want to get people out in the biggest space possible. And a lot of times those big visual spaces are overwhelming. Being outdoors, if you're riding in a car and you see that filtering of the light through the trees, that's
Yes.
really challenging. You know this, yes.
I do know this.
Yes, and unfortunately, those big box stores, which we have so many
Yes.
of, the Walmarts, the Costco's, the Sam's Clubs, those are really challenging because you have fluorescent lighting coming down from below, above rather. You have the shiny floor below, so it's reflecting back up, and you have the silver shelving so that the light is reflecting at you horizontally as well. So you have all of those areas that are causing not only brighter lights, but also glare, and that causes a lot of sensitivity. And if your vestibular system isn't working well, then it's hard to deal with that. So we want to get into whatever the biggest visual space is that a patient can handle. If that's only a room in their house, that's where we'll start, and we'll eventually try to work up to bigger and bigger spaces. But as far as keeping vision therapy fun, any activity that involves kicking, catching, throwing, batting, climbing, moving your body is really important. And any activity that involves using the 2 sides of the body requires using the 2 sides of the brain, which then helps your 2 eyes. So anything that uses the 2 sides, whether that's biking, walking, swimming, musical instruments are really good that require 2 hands, whether that's playing the flute, piano, guitar, anything that uses the 2 sides of the body is really good. And I really like swimming specifically because it uses all of the muscles. One very simple therapy activity that we do is that we have patients put their hands together and they make an infinity symbol or a number 8 lying on its side. They use their hands to move past the midline and rotate their wrists, again, to use the 2 sides of the body, which requires using the 2 sides of the brain. And that's something that you can do with your eyes completely closed on the bad vestibular days. If that's the only therapy activity you can do, you're still benefiting yourself by doing that. The other thing that we do in addition to the actual exercises is use a Syntonics light therapy, and that really helps the brain quiet itself down. It balances the sympathetic nervous system, which is everything that your body does under stress, the fight, flight, or freeze. Sometimes when we get into that sympathetic mode, we just stop all activity because it feels safer to not do anything. And the parasympathetic nervous system, which is everything that your body does during relaxation, healing the neurons of the brain, it's what happens during sleep, digestion, all of those activities. So the Syntonics light unit balances that. So we have the exercises, movement in big space, and the light therapy.
And that was my next question because, a lot of people have always asked me about the Syntonics. Can you talk a little more in depth about it? Because I know there's different colors that people can use. That's been a huge part of my healing and my therapy that I still do every day. So can you just go into a little more detail about that? I know all our patients would love to hear about that, our fellow warriors.
Yeah, I'm interested.
Yes. So light stimulates the brain in different ways. So you've probably heard about blue light glasses. Those are the glasses that you can get from Amazon. Yes, exactly. You got it. That block the blue light that comes from our screens. And those are very useful for people who have difficulty with sleep because blue light impacts melatonin production in the brain. So the light that's coming into our eyes actually affects our hormones. You've probably also heard of seasonal affective disorder. Some people call it SAD, where if you don't have enough exposure to full spectrum light, that it impacts depression in the brain. It affects our brain chemistry. So there are different wavelengths of light that stimulate the brain differently. And with all of our light therapy, we are looking at healing the damaged areas of the brain and making new neurological connections so that the brain can function more efficiently. If you have been reading a news website anytime within the last 6 months, you've probably seen an article pop up that talks about how green light reduces pain. Same idea is that that specific wavelength causes our brain to change its chemistry and releases serotonin. If you've heard of the selective serotonin reuptake inhibitors, SSRIs, that's what most antidepressant medications are. There's a big class of them. So it allows the serotonin in our brain to stay there longer. The green light actually increases the production of serotonin in the brain. So the specific wavelengths of light that we use really impact our brain chemistry, but they also impact our mental health. If you're listening in Illinois, we had several gray days in a row. And then yesterday we had a gorgeous sunny day.
Yes,
And
it was so nice.
it was beautiful. And everybody was just cheerful and
Yeah.
loving life because it really helps. And again, if you're having a bad vestibular day, and especially if you're sensitive to light, sometimes you don't want to go outside, even though you know that it's going to be good for you.
Mhm.
So we can use Syntonics and use just one portion of the full spectrum to help heal the brain so that you can get back to being outdoors in full spectrum light.
Wow, that is interesting. I have a quick question about the green light.
Mhm.
Could it be any type of green light? You know, I know they have these new Philip light bulbs and you can change it to green. Is that something that would work? Or do you have to get a special type of lighting that sends out the green light?
I'm going to answer yes to both of those questions. So
Okay.
yes, the Philips green light is really good for pain and depression. The more specific wavelengths of light are better for the vestibular function, traumatic brain injuries. So it depends on what exactly you're looking to treat. So both are good, absolutely, as is full spectrum light.
A lot of, the vestibular patients have anxiety. Now, isn't there a specific color that we can use with the Syntonics for that?
Yes, absolutely. And it depends on the patient. So I would be
Right.
hesitant to say use this color for everybody who might be
Yes,
listening.
of course.
But yes, there is absolutely a specific wavelength of light for each individual that's going to help them with the anxiety. And let's face it, when you're having vestibular symptoms, your anxiety goes up. When your anxiety goes up, then you have more vestibular symptoms rather, and it's
Yes.
just constant spiral, and we want to slowly unwind that and get back to baseline where you were before the vestibular symptoms started.
How would someone suffering, from the vertigo, dizziness, how would they benefit from these treatments specifically?
What we're hoping to achieve is that your symptoms become less severe, less frequent, and shorter duration. Ideally, the goal is to eliminate them completely. Sometimes that's not always possible, but even if we can get them to the point that you can get back to doing the things that you love, again, going back to your passion and your happiness, and being able to get through your entire day without being disrupted, that's the goal. If you're able to say, I can do everything that I want to be able to do, yes, I still have some dizziness, but I'm able to get through it, I consider that a success. Even better if we can completely get rid of all of the symptoms. Again, that's always going to be our goal. Sometimes we're not always able to do that, but we try to get there as fully as we can. One thing that I didn't talk about, though, this isn't specifically for vestibular, but this is for headaches. There is a Cefaly device. It's spelled Cefaly. It's like a TENS
Mhm.
unit, if you've ever used a TENS unit for muscle or nerve pain, that goes right on the forehead. And that works really well for migraines as well as vision headaches. So that is one other treatment option that we have. And then one other treatment option for post-traumatic stress disorder specifically is called EMDR, eye movement desensitization and reprocessing. So if the vestibular symptoms that you're having are also related to a trauma, it helps to do the EMDR. If you're having vestibular symptoms and headaches, it helps to do the Cefaly device. So there are options for treatment for those as well.
Yes, I've always been so appreciative of everything you've offered me that, hasn't been another medication. You have all these other approaches that are natural and, to promote healing. So I always appreciate that so much.
Yes, because the difficulty with medication, as you know, is sometimes the side effects are almost as bad as
Yeah.
what you're treating with the medication. And then some people are taking medication to treat the side effects from the first medication.
Yes, it's awful. Yes. So Dr. Sypherd, what do you see in the future for behavioral vision?
Well, we're hoping to provide a healthier and happier life for as many patients as possible. We want to reach as many families as we can. And even if they don't come here to our practice, there is a website that is www.covd.org. It looks like COVID, but with no I in it. We don't want COVID. We just want to be able to treat the brain. And that has providers across the country and across the world. So there are providers who do what I do in other countries as well, and certainly in other states. And there are other providers in Illinois if you're not near our practice. But what we really want is for patients to reach their full potential, to be able to meet whatever their personal goals are. So when the vision system works efficiently, it guides the body, it guides the brain, it tells us where to go. But when it's inefficient, it inhibits and it impedes our actions. It's a barrier to personal success. So once we can address whatever your vision concerns are, life gets easier.
Yeah, thank you for providing that link. That was one of my questions. How could someone see you or another provider in their area? How would they find it? So I'll go ahead and link that in the description of this video. I really appreciate that. And, listening to you speak, it makes sense to me that when I'm not feeling good, my vision, it's blurrier.
Yes.
And so that makes sense now that you're explaining this to me. So thank you. And Marissa, she's told me all about it. And, she's always doing her light therapy. And
yes, it's been such an important part of my healing, and just, Dr. Sypherd, everything that you've done for me over the past 10 years, has just helped me so much in my journey. And, I'm always appreciative of everything you've done for me and that you're always there for me. So thank you again.
You're very welcome. And even if patients don't live in the area and want to contact me, you can put a link to my website, all of the information's there. They can reach out to me as well, and I can help from a distance.
You just kind of tell patients out there who are suffering, could you give them a few words of hope? Because sometimes when we're in our darkest moments, we just feel like, we're not going to get better.
Yes. If you literally take it one step at a time and just do whatever you are able to. Let's say you have a pile of dishes in the sink and you say, I cannot do these dishes today. If you can do one dish, that's a start. If you have your whole pile of laundry that you have to fold and you say, I can't do this today, if you can get one pair of socks in the drawer, any action is a step in the right direction. So even if you feel like it's not enough or you feel like it doesn't meet your goals, you're still moving forward and you will keep moving forward. Absolutely, we have setbacks. It's not just a straight curve up all day, every day. It's a bumpy road, it's a roller coaster. But as long as you're moving forward, you're still moving and you will get there as long as you can get all of the puzzle pieces together. And there are people out there to help. And I'm one of them. I'm happy to be a part of your team, but there are other people who can help too. And sometimes it's just a matter of finding that right person that you connect with who can help you on your journey.
Yes, that's so encouraging. Thank you so much, Dr. Sypherd, for everything. And
Gladly, thank you for having me.
we will
Thank
link
you.
everything in the description. So thank you again.
You're welcome. Have a great day and happy